All right, guys. So we want to thank all of our listeners for joining the Healthcare Marketing podcast. And today we have a value pack podcast with two of the premier dentists here and around the Charlotte area, Dr. Patel and Dr. Alston. And they're going to cover a lot of topics. I think it's very valuable for younger dentists, experienced dentists, no matter where they are in their career, to kind of hear what they're experiencing with their practice as well. So before we get into these questions, I'm just going to open it up to let these two dentists introduce themselves.
Hi, this is Dr. Patel here in Matthews. A partnership with Dr. Austin here as well. And also I have another practice in Indian Trail.
Nice.
And I am Dr. Alston, and at the moment I am here in Plaza Midwood area, and I am in partnership with Dr. Patel and have my own office in Plaza Midwood.
Nice. So Dr. Patel, you have so your two locations, one Indian Trail, one Matthews, and then Dr. Alston's Matthews, and then also near the Plaza Midwood uptown area.
Yes. Yeah.
Awesome. So how did you guys meet? How did you guys decide on, bridging the gap and coming together in Matthews?
So we were with another practice before. A few years ago, we were partners there.
Okay.
And so it was a corporate style practice and we were partners there. So when we left, then we kept the partnership going on away from that. So that's how we ended up. But we were partners we've been partners since, I don't know, 2009.
Yeah.
Something like that. Yeah.
Oh, wow. That's awesome. Awesome.
Yeah.
So I know we're in the midst of, COVID-19 and, practices are trying to reopen slowly, but, be cautious about how they prepare to take in, their patients. I guess for both of you, how has COVID-19 impacted your practices?
Well, I think that the hardest thing is that since this whole pandemic started, we've had to, of course, shut down our offices and just work on a more limited basis, doing emergency treatment only. So, it's affected us that way, just financially. And but we also have to have a concern with our staff. And, we've had to put our staff on a furlough. So, us trying to balance, keeping them happy and, having some sort of, income and benefits and so forth. It's been a struggle, but, we're managing. We've, of course, also had to, like everyone else, apply for the small business loans and so
Right.
forth. That's all just very slow to come. But it has taken a toll. It's taken a hit on us financially.
Yeah, for sure. How about you, Dr. Patel?
Yes, same thing. I think the initial when we first told it was 2 weeks, then it got extended. And I think because it's so uncertain of what this thing can do.
Yeah.
You don't know, So originally, we said we're going to open 2 weeks, we're going to hit the ground gun. That never happened. And now we're in a different phase,
Right. So are both of you at this time in all three locations offering emergency dentistry?
Yes.
Yes.
Awesome. So how are you keeping your practices safe? So in just the general sense, people their mindset, they're still afraid to take those steps, but obviously if they have an emergency case, they need to be treated, pretty quickly. How are you, preparing for those patients or the ones that are coming to you now to, keep your practice safe, not only for them, but for your staff?
So most of the time it starts with a phone call. We're talking to them first, what type of emergency it is. And if we need to do a face-to-face Zoom call, we can do that, the Tillit Dentistry call.
Okay.
And then if they really need to come in, then we'll bring them in for any treatment or at least to see what's going on physically and take an x-ray if we need to, or refer them out, and put them on medication to keep them comfortable, or do minor treatment if we have to keep them comfortable. And then to keep them safe in the practice, we've followed the interim guidelines by the ADA and the CDC. And these guidelines, trying to keep to those. So that's what we've been doing.
Gotcha. With Tillit, how is that? Are you getting a lot of, are you seeing a lot of people use that option to be able to communicate virtually?
Some.
I think yes, I think we are seeing that that's helping. We've had some like just brand new patients that have never been to the office before utilize the teledentistry side, and that way we're able to talk to them, take pictures and stuff of whatever the problem is, and then speak with them and try to address their needs that way. I'm surprised at how many patients not of record that we are getting through the teledentistry side during this time.
Oh, that's awesome. So I guess for a lot of dentists who are not utilizing teledentistry, like how simple is it? Like how simple is that process to set that up and to use that feature to be able to communicate virtually? Because I hear in the community now a lot of dentists just they're shutting down completely. They're not even utilizing teledentistry. So is it an easy process to kind of go through?
Yeah, it is. I mean, it's very and to get them, because some of them are older patients who don't have smartphones or anything like that. We can just make a phone call. They send a picture to us. That's one way of doing it. If they don't, or their relatives send it. If someone who lives with them, most of them have smartphones. Most people have smartphones, and they're actually willing to do it this way because this is probably the first time we've ever used it this often. So, it's very simple for them. I don't think it's ever been a problem for the patient to get the app or on the computer and do it. It's so simple.
Do you have a recommended, I guess, teledentistry website that you would use for any kind of, I guess, any of the patient management? Like if it's like, I think I've heard like DoxyMe or DoxyWalk.
There are a few. Right. We use Zoom, but I know at the moment some of the laws are laxed of using because of the HIPAA rules are laxed during this time. But going forward, we'll probably have to use some sort of platform so it's compliant.
Okay. Awesome. And so, Dr. Alston, you talked about just how COVID-19 has impacted each business financially. I guess everyone's feeling uncertain, but how do you guys in your mind right now creating that positive reinforcement to help you get through this? Like how are you communicating with yourself, right, or to help you just stay positive during this time frame?
Well, for myself, I typically am just try to be a positive person in general, and really looking at being thankful that hey, we're here and we're all safe, and then trying to admit that to my staff members, hey, yes, this is something that's very serious, but it's not anything that we can't try to help to kind of like control what we're doing and so forth. Trying to instill the positivity in them. To our patients, we've been doing like videos, so that way we can post them on social media, and then the patients can kind of see we're walking through the office to kind of show them what we're doing in the office to help protect them and to help protect our staff. So that way they can see the behind the scenes, of what we're doing. I think sometimes that peace of mind for them to visibly see it, and keeping in contact with them through social media or through email. We send blast emails out. Those things can help to keep the patients, I think some of their fears down once they can really see what we're doing. And we just walk through it step by step as far as it's done.
Oh, that's awesome. So I think, for what I'm hearing too, is that there's a lot of leadership, what you're establishing is a lot of leadership opportunities for yourself within your practice, from the way you guys are communicating with your patients, but also with your team, how you guys are, really focusing on, creating that right mindset with yourselves to be able to prepare your practice to reopen and take a lot of these patients on. So I think the leadership mindset is critical during this time frame, because I'm sure a lot of people could say, hey, I'm throwing my hands up, I don't know what to do, and not really plan out.
Right. And with that being said too, Dr. Patel and I, over this time period, we've had like 7 weeks now, we've done numerous webinars and stuff. So that way we can just stay abreast of what's going on out there with the COVID-19. so we're keeping ourselves educated, keeping ourselves in the loop. We've had several Zoom staff meetings as well. So that way we can relay any information that we've learned to our staff members.
Awesome.
And then we can, have, just have a breakout sessions with them as well. Hey, whatever concerns you have, let us know, and we can help ease their concerns, because hopefully we've gotten some information so that it can help ease their concerns.
Right.
And, and if not, then we'll find out what the answer is. There are a lot of unknowns to this whole thing anyway. So, some things we do have to kind of take one step at a time and one day at a time, but it takes us to, really be in the forefront, trying to learn as much as we can about it. There's new information coming out every day. So,
right.
Between the two of us, hopefully one of us has had a webinar that has information that's necessary.
Yeah. I think the key is to keep in touch with the staff all this time, because that's what's you want a staff to come back to the office. That's got to come back and they feel comfortable. And so by doing that, that's the first thing we did, is to keep in touch with them.
Awesome.
That was more important to us. Yeah. And obviously the patients, but the staff is very important to keep in touch, because they're at home stuck, so they need to know what's going on.
Right. Do you recommend, any webinars that you would, suggest dentists to go to and start, listening to?
There are lots out there. I think every dentist is probably got an email for a webinar. I mean, there's so many. There's some webinars I sign up for and I can't even get on to, because I'm missing that one because I'm doing something else, because I forget about it, So, but they are there, because if you're a dentist, somehow you will get them. You will get them by your email.
Through the ADA, you can just kind of go on their website, and there's tons of webinars. Most of these webinars record the information, so if you missed it the day of, go back to it. A lot of these too have CE court credits that you can get alongside of it. You can get like a hour credit or something, so you kind of kill two birds with one stone. But yeah, there's tons out there. You can probably just Google dental webinar, COVID webinar. It's going to come up. Something's going to come up.
Yeah.
Right. Yeah, that's interesting. So I've talked to a lot of dentists. You guys are the first ones to say anything about the ADA website, showcasing a lot of the webinars. So I think that is very, that's a valuable resource for a lot of dentists to go. I'm sure they're on that site, but just hearing that, I think, is going to be valuable.
Yeah.
What are you guys doing in terms of like efficiency? So I know, like, as business owners, even for myself, there's opportunities where things slow down, right? And we have time to think and, take a step back, and there's all the grand things that we want to do to help our business grow. Is there that one thing or multiple things you're like, hey, this needs to be more efficient within our practice? Now we have time to think about it. And now you're kind of, thinking more how you can make it more efficient to help your practice grow long term. So are there any of those things, or just that one thing you're like, hey, it needs to be more efficient, now I can think about it?
So we've gone back and reviewed all our systems in the practice, and because we've had our managers coming in, and they've actually rewritten them or redone them to make it more efficient. Like, let's say billing and collections, something like that, to come up with a schedule so that everyone sticks to it, and they can be whoever does it is accountable, and all that. So we've done that. And then we've got, obviously with the COVID, now we're redoing all our protocols for our cross-infection control and that. So we're going to, but it's going to be a new norm, definitely, when we come back. Yeah. And that's what we're preparing ourselves for. It's totally different to what we're used to. Totally.
Right.
Yeah.
And I think because of this new norm, and we're going to almost, day one is going to kind of be like, we're like doing a dry run, of it, I'm sure that with all these new protocols and everything, there's going to be some tweaking to try to make things a little bit more efficient once we really kind of see how this is really going to play out.
Right.
Because it's different. It's different for us. It's different for the patients. We're trying to give patients, the information before they ever come in that, hey, it's different out here and things are different. But I'm sure too, patients, when they do get here, they're going to have many more questions, So it's just going to be a one day at a time thing.
Yeah, and to your point, like you're still over communicating, you're educating them. I
Yeah,
think that's all you can do, right?
exactly.
It's
That's all
really,
you can do. And I think I've always felt that that's the most important thing, is to be as transparent as we can.
right.
And I never feel like you can say enough about something. Unfortunately, I feel that way. And so I'm usually the talker, but I think knowledge is power, and the more you know, then the better you can take care of yourself.
Right, right. So how are you guys like how do you think about your marketing differently? Like how are you preparing for your reopening? Like how are you thinking about like, getting more patients? Like I know I'll jump into a lot of the strategies, but how are you thinking about it differently?
So look, during this process, we've learned about Tillit Dentistry.
Yeah.
So we're thinking of doing more marketing through that. We also, what's going to help us to limit the number of patients coming in the office. That's the idea behind it as well,
Yeah.
to keep them safe. So we can do some things by Tillit Dentistry, some certain appointments, marketing wise, I think we've learned a lot with all these webinars as well to see what the options are out there,
Yeah.
And obviously you're going to help us, Lamar, with this as well. So
Exactly.
yeah.
I better be.
You better be helping us.
Yeah.
How about you, Dr. Alston?
Pretty much kind of the same thing that Dr. Patel said. I think one thing is, because everybody's confined to their homes right now, and there's not much going on. I know me personally, I've done a lot more little videos. I'm learning to get comfortable doing those videos, and working with filters and all that kind of stuff to
Yep.
post on social media to just create that extra avenue, where before this all happened, I didn't do that. And I think I probably felt like I didn't have the time to do it. But now that I do have the time, all the time in the world, I'm learning how to do it and feeling comfortable doing it, and trying to make that probably a part of, my whole, office and the whole platform and marketing, just from here forward.
Yeah, that's a
I
good
think
point.
that's important. I think people like to see us, and if they can see us and hear us, behind the scenes, then, and relate to us, then, that might also help to kind of be a connection there with the patients.
Yeah, because if you think about it, like that's so important, because if I'm a patient, I can connect to realness, like with seeing the doctor, seeing the staff, seeing patients there. Like that's just a different level of connection. So if you're doing those things, especially during this time frame where people are very hesitant, they know they need dental care, like they know they need to be getting something treated in their mouth at this point, and they're afraid. But if they can make that connection online, I think that'll help them lift some of that fear. I think now you guys are offering teledentistry. I think that's amazing, because a lot of dentists are not. But and a lot of patients think that they don't have any other option but to go in right now. And I think helping them see that they can at least have a conversation, first online, virtually, to be able to communicate what their pain points are. You guys giving them a game plan on how you can help them. I think that's a whole nother level of marketing. And now with Google My Business, I'm seeing, like with Google also, they're changing, their features and how they're going to present, specific, marketing efforts and practices to the community based on what they're searching for. So for example, if you have, a COVID-19 letter on your website, like you guys do, they're going to pretty much give you more value when someone's searching for COVID-19 specific dental terms, or, teledentistry. So they're going to give you more value because you have that content on your website. Even if someone's like searching for, dental, dental urgent care, or emergency care, oral care, they're putting some kind of oral dentistry on that term in Google. Google's relating your content on your website based on what you can offer them, because it's relevant. So now that you guys are offering teledentistry, it's gonna help you stand out amongst your competition. So it's awesome you're doing that, for sure.
Great.
Yeah. What are you guys most excited about? Like, even, this is a downtime for the economy, a downtime for everyone. I guess even coming out of this, you've had time to, think and, strategize and plan. But what are you excited about once things are moving back in the right direction, and people are actually coming more frequently? Like, what are you excited about for the future in the dental space?
Well, obviously, I think because our schedules are going to change, I think that's more. I think I'm excited about that because it's going to be the old. I wouldn't say old way, but it's something that we always imagine ourselves to be practicing that way. The time that we spend with the patients. So that's one thing, and then we're going to introduce more procedures into the practice as well, which we're looking. That's why we did these webinars. We're excited about that, and Dr. Alston and I are looking at doing sleep apnea, sleep in the practice, and helping those patients.
That's awesome. Awesome.
I am so pumped about, here we go. I am so
yes, she is. She's been
excited about this sleep dentistry. You just don't even know. I'm like I'm just like a little kid in a candy store. But that has been one of my passions for quite a while. And it seems like lately things are just kind of falling into place with it. So I was on a call just a little while ago, right before this, regarding that. So it's just something that so many people need and out there, and I'm just thrilled to be able to be a part of it, to help provide the service and try to help take care of people. That's my whole goal with dentistry anyway, is to just take care of patients, and this is huge venue right there to work into. So I'm excited. Can't not wait.
That's awesome. And I think both you guys, like, your mindset is you're even more hungrier. The grind is, even more heightened in terms of how you're going to serve these
amazing.
patients.
It's really amazing. I think I've always said things happen for a reason, and, when we've been doing this for 25 plus years. So,
right.
But we've always just been constantly working. And I told somebody that, I've never had so much time on my hands. Even when I was pregnant and I was on maternity leave, I wasn't out as long as I've been out for this COVID,
That's crazy.
So it is crazy.
It's crazy,
my whole life I've never been so, just so, what do I do? And I'm like this go kind of person. So, having the opportunity to have time to sit and just pause for a moment, I think was huge. And I think it was well needed. I hate that it was for the circumstances, but through this, I think, so many people can come out a lot better, a lot more prepared and ready to do the things that they need to do, And I think that's something that Dr. Patel and I both have had that opportunity, because we are like these go-getters, and we just, we never rest. So we've had to try
we don't.
and, in trying to rest, we've learned so much, through this time, and we're ready to just share it and to take it to the next level.
That's awesome. That's awesome. So I guess as like the last question for you guys, what are some encouraging words you would give to, let's say there's a younger dentist who, inspires to be, a dental practice owner, or there's someone who's, they own their own dental practice currently. What are, I guess, encouraging words you would leave with them if they're watching?
I would say invest in your team. That's the number one. Got to invest in your team. That's what's going to keep you going.
Yeah.
I would have to agree there. I think that the team, because without the team, you're not anything. You're not a standalone person. You can't run the office by yourself. So you have to invest in your team. I would say I would agree there.
That's awesome. So all you dentists who are listening out there, number one thing you better be doing is investing in your team. So Dr. Alston, Dr. Patel, I appreciate you guys jumping on the podcast. I think this information is going to help a lot of dentists who, are going through exactly what you're going through, or, aspire to be where you are currently. So thank you again for your time. I appreciate the value content, and I'm looking forward to seeing you guys soon.
Thank you, Lamar.
Fantastic. Thank you, Lamar.
Have a good day.
Appreciate it.
Thank you.
Bye.